Ready?
Yes.
Good morning. I'm Dave Anderson, and I serve as chair of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted in hybrid form, with some individuals remote by conference call or other electronic medium, and some individuals present at the board's office. Denise Seisman.
Present.
Jill Flessing, she's out.
Present.
She's here. Very good. Linda Heitzman Powell.
Present.
Donna Hunter Queel. Mary Jones.
Present.
Jim Kilmartin.
Present.
Richard Nobles.
Present.
Andrea Morales.
Present.
Cynthia Schindel. Laura Shaughnessy.
Present.
David Stevens.
Here.
I note the following staff members are also present. David Fine. Here. Leslie Allen.
Here.
And Cindy Dericle.
Here.
Sorry if I butchered that, Cindy. Tim Resner, serving as legal counsel for the board, is also present.
I'm here.
Next, David Fye will read a message concerning this meeting being held remotely.
Great. Thank you, Dave. And I went ahead and also started our conference call line as well. So this is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the board to provide public comment or answer questions from individuals. Individuals requesting to provide public comment to contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. An individual from the Kansas Art Therapy Association has been approved for 10 minutes of public comment on proposed legislation on art therapist licensure. Because we are conducting this public meeting in hybrid form, state for the record the following information. Access to this meeting is being conducted in person and by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted in hybrid form, the requirements of the KOMA are not suspended. As such, we will be conducting this meeting pursuant to the KOMA. On December 18th, 2024, we sent notice of the board meeting to all individuals that requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials have been posted on the board's website and are available for review. You may also request a copy of the agenda by sending an email to David Fye, specifically at david.fye@ks.gov, with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. And the notice also states that if we have any technical issues during the meeting, you may send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did see that Cynthia Schindel just entered the waiting room, so I'll go ahead and admit her to the meeting so she is in attendance as well.
Thank you. The meeting's now called to order and the board will begin its discussion of the next item on its agenda. Our next item is agenda approval. Any additions to the agenda?
Move to approve.
Okay,
Second.
very good. Thank you. We have a motion and a second. All in favor, please say aye.
Aye. Aye.
Opposed, same sign. Motion carries. Thank you. Next, public comment. Haley, would you like to come to the podium?
I would, if that's okay, I'd like to invite my colleagues to join me at the table.
Is that okay? I think
Sure.
Sounds good. Good morning, members of the board. We, the members of the Kansas Art Therapy Licensure and Advocacy Coalition, are grateful for this opportunity for public comment at your meeting today. My name is Kaylee Weisman, and I am a board certified and registered art therapist. I'm a third generation Kansan, and I live in Overland Park with my husband and 3 kids. I received a master's in clinical art therapy from Long Island University in New York, and I moved back to Overland Park just days after my graduation to eagerly begin my art therapy career here in Kansas. Over the past 13 years, I've worked in community mental health with adults with schizophrenia and bipolar, in skilled nursing facilities supporting nonverbal older adults with Alzheimer's and dementia. I've worked with the St. Luke's Marion Block Neuroscience Institute, providing art therapy for adults with Parkinson's through grants from the Parkinson's Foundation. I pioneered the art therapy program for Children's Mercy Hospital Network, where I worked inpatient with children and families facing some of the most unimaginable diagnoses. Most recently, I helped facilitate a federal grant for arts and mental health from the state and local fiscal recovery funds program through the American Rescue Plan Act. This federal funding allowed myself and 3 other art therapists to provide free art therapy throughout Johnson County in 2024. We were able to bring free services to various public schools, community day programs, juvenile detention centers, treatment centers, and more. I'm joined here today by some of my esteemed colleagues and fellow members of the Kansas Art Therapy Association. Raven Milam is a registered art therapist and is the president of the Kansas Art Therapy Association, which you may hear as referred to as CATA. She has been an art therapist at Vallejo Behavioral Health for the past 10 years and is a leader in the Trauma-Informed Care Task Force and Implementation Work Group, as well as the graduate and undergraduate site supervisor for art therapy interns. Wendy Lynch, who is joining us by Zoom, is an LCPC and an LMAC, as well as a provisionally registered art therapist. She's the vice president of CATA and has worked at Vallejo as well. Wendy currently works in her private practice, Making Meaning Art Therapy in Lawrence, and is part of the Lawrence Creative Therapy Center. Wendy also teaches pre-undergraduate art therapy courses and graduate art therapy courses at Emporia State University. Amber Dalzell is a board certified and registered art therapist and credentialed supervisor, as well as an LCPC. She has worked at Kids TLC in the Olathe School District and continues to offer postgraduate supervision as well as runs a private practice. Noelle Kermans is a board certified and registered art therapist and has provided art therapy services at Advent Health Hospital, Arista Recovery, ED Care Eating Disorder Recovery, and Lawrence Creative Therapy Center. Sherry Jacobs, who is joining us by Zoom as well, is a licensed clinical marriage and family therapist and works in private practice. She has also provided art therapy services at Marillac, Two Rivers, Village Shalom, Turning Point, and is also a published author on the use of EMDR and art therapy. We are grateful for this opportunity to share our clinical perspective on the necessity of providing a path for licensure for art therapists in the state of Kansas. As you may have heard from our brief professional bios, those of us that present before you today have provided extensive clinical services to many institutions that are pillars in the medical and behavioral health landscape throughout Kansas. We represent a very small sampling of the larger art therapist community within this very state. For decades, art therapists have been in high demand for the diverse clinical skill set that we bring to the table. However, with the growing popularity of expressive therapies and the ongoing demand for services to address the mental health crisis, Kansas is facing an even bigger epidemic. It's safe to say that there are a substantial number of mental health providers offering services outside of their scope of practice. It is with this in mind that we, the Kansas Art Therapy Association Advocacy Coalition, advise the Kansas Behavioral Sciences Regulatory Board support a bill that would provide regulations and licensure for professional art therapists. First and foremost, art therapy licensure under the BSRB would ultimately protect the public to help the public identify properly trained professionals from fraudulent clinicians utilizing tools outside of their scope. Clinicians who lack proper training may not be aware of the impact of various media on a client's emotional or mental functioning. Likewise, they may not know how to guide the client to calm and safety if unexpected images, emotions, regressions, traumas, or impulses emerge. These troublesome errors, due to insufficient training and experience, may cause the client psychological or even physical harm. Each of us here today have extensive training in psychology, therapy modalities, and artistic techniques, enabling us to provide direct clinical services with specific goals and measurable outcomes. Art therapists offer services that meet the same ethical and professional standards as other therapy services. Our training prepares us to understand how art interacts with the client's psychological disposition and how to safely manage and interpret the reactions that different art processes may evoke. Art therapists have in-depth knowledge of clinical interventions and the neuroscience that backs it. Art therapists have substantial experiential learning and protocols that support how to introduce these interventions, the art media that is indicated to elicit certain responses, and more importantly, what could potentially be harmful to a client. These are competencies that greatly distinguish our clinical skill set and expertise and must be gained through a master's level art therapy training. Licensure would also grant title protection for art therapists. Therefore, only clinicians holding the Licensed Professional Art Therapy, LPAT, that I refer to, the LPAT credential, can call themselves professional art therapists or say that they're providing professional art therapy. This would prevent non-art therapists and undertrained related professionals from calling themselves art therapists or say that they are doing art therapy if they are engaged in private practice. They may still use art materials in their practice. This is not something that we can regulate. Licensure would also provide a better continuum of care. Many clinical sites, as you've heard from our work experience, many clinical sites currently offer art therapy as a service, where art therapists serve as part of the treatment team. Art therapists make outstanding co-treaters, I might add. We provide a service that can help a patient meet many gross motor, fine motor, social, emotional, and rehabilitative goals. We are trained to evaluate for many what us art therapists call graphomotor qualities. We can provide valuable feedback to clinical teams about a patient's progress, coping, and level of cognition, all from exploring the artwork. Art therapists are therefore known to be prized collaborative members of multidisciplinary treatment teams. But what about the clients that are resistant to talk therapy, that have a cultural bias to therapy in general, that are neurodiverse and have an intellectual delay or disability, or a client that struggles with verbal communication or is completely nonverbal? Art therapy's hands-on nature is a soft entry point for therapy for individuals with cultural biases to therapy or have not been successful in traditional talk therapy. Art therapy can incorporate multisensory, tactile, bilateral stimulation to integrate both sides of the brain, as well as a bottom-up approach. Art therapist training in symbolic imagery and meaning making allows for multicultural and even bilingual accessibility, which is another reason why art therapists are often amongst the first that are deployed when a community has faced a natural disaster or trauma somewhere across the globe. Licensure for art therapy would therefore allow for diversified clinical services in our state. Finally, licensure for art therapists in Kansas would attract art therapists to stay in or move to Kansas. Art therapy is now a regulated mental health profession in 15 states and the District of Columbia. There are 11 states with current licensure bills and advocacy campaigns in progress. the Kansas Art Therapy Association therefore requests that the Kansas Behavioral Science Regulatory Board endorse a bill that would grant licensure for Kansas art therapists for the reasons we have presented before you today, and to pave a path forward to improve the mental health crisis and access to qualified care. Thank you for your time.
Thank you very much. Any questions from board members?
Does licensure in any way impact reimbursability for your services?
Yeah, it definitely does. I mean, especially being part of, again, like the qualified license, therapeutic services that would be offered, then it would help pave a way also for insurance reimbursement, but you know, our bill doesn't necessarily state that specifically. So the bill that we've introduced, which you have a copy of the draft, is one that we presented last session, which kind of died just due to lack of momentum. So that's why we're kind of geared to really present a lot of momentum to move it forward, and why I you know, very generously was able to kind of interact with David to have this opportunity to be able to say, like, we want to be able to have a partnership with the BSRB. You know, we refer to the BSRB in our bill and feel like this is a really next opportunity to have a real cohesive partnership to be able to provide this type of license, clinical service, and then be able to pave a path towards insurance.
Who are you currently certified or registered by? I've heard you use that phrase, so I was curious.
Sure. Yeah, so our national board is the ATCB, that Art Therapy Credential Board, and so they provide a national examination, and so a lot of states that offer licensure kind of already use that as their metric. You know, so once passage of the ATCB, after passage of that examination, you know, then some states have different qualifications, you know, as long as and I've kind of given a cheat sheet as well as far as like what are states, but different states kind of vary as far as what, you know, how they kind of model the different levels. So like, for example, in our bill, we present with the professional level, the LPAT, the licensed professional art therapist, as well as a clinical level. So the licensed clinical art therapist. So we've kind of modeled it pretty similar off of the LPC and LCPC as well.
Thank you. Other questions, comments?
Any of my colleagues want to share anything? Professional experience with?
I'd like to respond to the previous question about reimbursement. And while, yes, Kaylee mentioned that our current information doesn't touch on reimbursement yet, our hope is that with getting licensure, I can say as someone who's duly credentialed with my LCPC, my LMAC, and then my art therapy, that I often have a wait list for people seeking art therapy, and I want to refer them to other art therapists. And part of the barrier there is a lot of the people that I serve have Medicaid, and they can't pay out of pocket. So in order to get those services, they would have to pay out of pocket with money they don't have. So being able to get licensure and then reimbursement would be tremendously helpful for the people in our community to be able to get the services that they desperately want and need. So thank you.
I'd like to just add one anecdotal piece. I'm Sherry Jacobs. The origins of the field of art therapy, which is about 55, 60 years old, actually are in Kansas. Many of the founders of the field came from Menningers and really set a precedent for what this field is, which has translated into how art therapists are trained all over the world. And it's a growing profession all over the world, everywhere from Iceland to central China and everywhere in between. And really the origins of our theories and how we operate came from clinicians from Menningers many decades ago. Thank you.
Paul and Don Jones are the two art therapists from Menningers. Also, Topeka has a street named after an art therapist, Huntoon. It is actually Mary Huntoon, who was an art therapist. So Topeka has a long history with art therapy. Kansas is part of the founding of art therapy as a practice as it is today. It's such an important history that we really are passionate about and want to continue on sharing with everyone. We should really be proud of our history and what we contributed to the world.
Two other kind of final, just tangible pieces. Art therapy was highlighted as far as a really transformational clinical service provided for veterans and to treat PTSD for veterans on the cover of a national geographic magazine just a short while ago. And then just a personal piece. This was created for me by a patient when she was discharging when I was working in the pain clinic at Children's Mercy. This was a patient that was very resistant to other forms of therapy, but as a parting gift, created, this is my little badge tag that she's wearing, but she hand sewed, hand stitched, and stuffed this little memento. So again, just kind of recognizing that I think we're in a generation where traditional talk therapy as a clinical service is not a one-size-fits-all method and modality that really can meet all the needs of our population. Thank you again for your time.
Thank you very much. Okay, we'll move on to our next agenda item, a review and approval of minutes from the previous board meetings on November 4th and December 16th. Has everybody had an opportunity to review those? Any edits or additions?
I move to approve.
Okay, thank you. Thank you. We have a motion and a second. All in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. We need to do one for each.
Nope, one motion is fine.
Very good. All right. We'll move to the executive
Thank you.
director's report. Thank you all.
Thank you.
Have a good day.
All right, we'll go ahead and discuss first some operations updates, and then we'll move to some legislative items and then some updates for different associations and other groups. So first with some operations updates, we've had a little bit of an unusual time. Those of you who are not here in Shawnee County, we've had some unusual winter weather the last few weeks. This past week, our office was officially closed by the governor due to a declaration of inclement weather on Monday and Tuesday. And the governor had previously issued a closure of state offices on Thursday as a national day of mourning due to the death of former President Jimmy Carter. So it has been a little bit of a struggle, not to mention, you know, just seasonal illnesses and things like that. But happy to show that the staff is very resilient, and we're working on everything as best we can. But with the holiday season, things are quickly picking up at the legislature as well. And so jumping on a number of different items. But one item that I would try to keep the board updated about in terms of outreach has to do with our YouTube channel that we use to broadcast meetings of the board and also advisory committees. I got a notification that we have had our 4th birthday of the YouTube channel. This was started back in January of 2021 during some of the earlier stages of the pandemic as a way to provide more accessibility and have our meetings available to the public in a more structured way. And I'm happy to say that since that point, we have broadcast live or uploaded 187 meetings between the board and advisory committees. Those have been viewed, I believe the number I saw today was 10,535 times. So really happy with the level of transparency that the board is using for all the different discussions and everything else. I know for a fact that other states are looking at the channel and trying to adopt something similar in a lot of situations as a way to get information out to the public and licensees. And so I'm really proud of the work that we're doing here, and really happy that, you know, it has led to additional conversations and discussions and more people asking for things like public comments, and that they're really seeing how hard the board is working to try to address issues like workforce and other things like that too. In terms of other outreach efforts, Leslie and I have started to schedule a number of different presentations to student groups. One of the things that we do is for students who are getting close to graduation, we either do Zoom meetings or in-person meetings at a number of schools around the state where we talk about the steps to get licensed and try to help that process go as smooth as it can. And then also we tell them about their responsibility as a licensee under unprofessional conduct and how to be proactive in their approach to understanding what their requirements are as a professional. And so we are expanding the number of different schools we're working with opening up more conversations with those different groups. And happy to say that that is going really well. So, we always tell them tentatively this time of year, we can put something on the calendar, but subject to change based on legislative activity. But we're really happy to continue to answer those questions and meet more students that are going to become professionals in the area. Another item in terms of outreach, this past year, the advisory committees have been working on surveys to licensees. This started as sort of an evolution of surveys that we had done previously for the social work advisory committee and the social work profession to look at different things like telehealth and the effect of supervision, moving from in-person supervision to more supervision by remote access. We wanted to allow the other professions the opportunity to survey their licensees too. Some of this could help motivate and drive the work of the advisory committees in the future by collecting input from licensees on different issues they're seeing out in the field and different things like that. And so we also have been having a discussion this past year about defining workforce in better ways. And so we have put together survey questions for each of the professions. Happy to announce that we are planning to launch those surveys tomorrow. So those should go out over email and then individuals can click and report those. We're planning to hold those open for about 10 days. So people will have 2 different opportunities to fill out the survey. And so that way, when the advisory committees meet in February, we should have reports for each one of the advisory committees to review. In terms of an update on revenue and expenditures, we are a fee-funded agency. And when I say that during meetings, what that means is that we don't receive money directly from the state to operate. We charge license fees, and then based on the fees that we collect, the legislature limits our ability to spend money up to a certain amount each year, and that limit is put in the appropriations bill. Basically, this year, we are going to go before the legislature and discuss the budget that we had submitted back in September. But currently, the balance in our one fund, the BSRB fee fund, is now right around 1.9 million. It had been up as high as about 2.2 million or so. And then as of about this time last year, it was, I guess back in January of 2023, it was about 2.2 million, 1.18. And then last year, as of this time, it was a little over 2 million. And then now it is currently at 1,923,000. That's up a little bit because revenue has come in a little bit higher than expenditures, but we don't have consistent expenditures. We do rent every 3 months or so. It's paid out in different things. So you really look at it at the end of the year. But a number of the different items the board has done in recent years to decrease fees and absorb certain costs were done by design to bring the balance in the fee fund down slowly over time. And then at the September meeting, the board took another action and voted to decrease fees additional amount. So we talked about the original license fees that are going to be decreasing by $50 each. And we are hoping that will make it through the regulatory process and be implemented sometime around the summer. But as of right now, the balance in the fund is about 1.9 million. In terms of other items, I wanted to give you an update on the implementation of our partnership with CE Broker. This was a private company that the board is interested in partnering with. They provide a free service to licensing boards and also to licensees. The ability basically to upload your documentation of completion of continuing education hours. So if you are pulled for audit, instead of sending that information back and forth to the board for us to review, if someone utilizes CE Broker, we can log into the portal, review their materials, and finish the audit in a much quicker fashion. It also would benefit licensees so they don't have to hold on to those documents, not knowing if they will be selected for audit. So it gives a nice service to licensees. We have been working very hard on this endeavor, and we rolled this out for social work and professional counseling as of October 1st. Did additional work with their staff to implement this for marriage and family therapy and master's level psychology on November 5th. And then the last 3 professions, addiction counseling, behavior analyst, and licensed psychology, were implemented January 7th. And most of the comments that we have received have been very positive. People really appreciate the board allowing them this service. And so we are continuing to work on a few minor technical issues, but overall, the information we've been receiving from licensed applicants has been very positive. Just a couple other items in terms of operations. Last year, there was an executive order from the governor that mandated that all agencies put together a continuity of operations document. And this is not simply a short document. This was a pretty extensive process, and there's a website designed for agencies for this process. And so we did a lot of work behind the scenes last year to get this up and running. And then this past year, I guess it was 2 years ago, and then this past year, we had to do updates and resubmit. So we did do that and completed that by the end of the year. So that is all in alignment. Most of this has to do with what would we do in a worst case situation? So what if there was a fire to the building? What if there was a tornado that came through? What would we need in terms of technical support? What are the bare minimums we would need to relocate to an alternative site, or where would we go? And so we do have those things in place. We hope that it will never happen, but if it does happen, we do have something that has been reviewed and approved that will at least put us in a good place to get up and running as quickly as we can. Additionally, we have been holding more meetings, working with the Office of Information Technology Services to begin the process of converting our licensing system over to the Atella platform. The board did vote for us to move that direction, and we have been in a list of agencies to begin that process. We have had at least 3 meetings so far, working with their staff so they can understand our existing processes and what forms we utilize. They are trying to understand what all we are asking and requiring from applicants for the different types of licenses that we have. They have informed us that based on the 7 professions and the fact that we are essentially 7 boards in one, we are probably the most complex of the agencies they've worked with so far. But it is to our benefit that they've already worked with you before they started working with us. And so we are continuing to work with them. This process, they said, will probably take about 2 years until we're fully moved over to the new system. But we are excited to be moving in that direction, and really happy with their staff. They really took a proactive approach, looking at a lot of our forms, trying to understand a lot of things. Some things, the terminology, we've had to have discussions about to make sure that they understand. And then ultimately, what we want to do is actually move beyond what we currently have to a more integrated process. Right now, I think some of the reasons why things are complicated is because we have had issues at times with someone applying for licensure, and we've developed fixes, but a lot of those fixes are separate from each other. And so right now, if you want to apply for a license by reciprocity, you fill out this form, or you want to fill out a license from the initial application, you fill out this form, or if you want to fill out a license to another method. But really what those are a series of questions. And if we can build those into one system, someone can really get through that process and then be directed to the appropriate fee to pay. It'll be attached to their account. So we see a vision for the future. It'll just take us a little bit of time to get there. But I think once we're fully moved over, it'll be really nice, and it'll be beneficial for staff too. Moving to some other items in terms of legislative updates. This week starts the legislative session for 2025. The state of the state is the governor's presentation to the legislature and to Kansas concerning the state of Kansas, and also budget initiatives from the governor. Usually the following morning, the formal governor's budget report is delivered to a joint meeting of House Appropriations and Senate Ways and Means. This year it's going to be a little different. That presentation, I understand, will still take place Thursday morning of this week. And the governor's state of the state will be on Wednesday evening. But this past fall, the legislature decided they wanted to take a different approach to some of the budget issues. So they held special interim meetings as legislative budget committees to consider coming up with their own bill in terms of the legislative appropriations process. And so I don't know fully how that's going to go this year. Traditionally, what we've done is the governor has released a budget report, and then we've worked from that governor's budget recommendation as the starting point. And then we've gone to House committees for budgets, Senate committees for budgets. They've made separate recommendations. They go to their own appropriations bills, then they come together on items of different. This year, I'm not sure. The governor is still planning to put forth a budget. And I think by statute, I think the governor is required to do that. But from what I am hearing, it sounds like the legislature will also put forward their budget bill. So in the budget committees, we will comment on what the governor recommends for the agency, but we will also comment if there were any recommendations for changes in those legislative committees as well. And for the BSRB, we're one of the smaller agencies. We don't receive any money from the state general fund. So our budget is less complex than others. So I don't believe that there are any changes unless there were other items that will come up this spring, but I will keep you all updated on it. In terms of the BSRB bill, you all have recommended changes and asked for legislation to be brought forward this year. Since we met last in December, I had reached out to the chair of House Health and Human Services, Representative Will Carpenter, who's the chair of that committee. And he had agreed for us to work with the revisor's office so that language could be drafted. And I've been meeting with Jenna Moyer from the revisor's office, but she has all the items the BSRB had agreed to. We can still make tweaks before that bill is officially released. There is one item I wanted to bring to you all, and going through some of that information, there was the item that is basically a new process. It would allow the BSRB the ability to review a program without a specific applicant for licensure. We've talked about there may be programs, especially from out of state, that say, will you review our entire program and tell us if you meet the requirements for licensure? And we really don't have an ability to appropriately use staff time for that process. But for a fee, we would be willing to do that. We just want to make sure that we're using the fees we collect appropriately. So this would allow a new process for someone to pay a fee, us to do the review, and then issue them a decision. And what we initially had talked about was if they want to make further adjustments within the year following the decision, we will work with them to do reassessments at no additional cost. What I'd like to propose to you is if we change that to 2 years, I think it'll be beneficial. So if we give an assessment to someone for their program for the next 2 years, if they would like us to do reassessment, I think that's something that we could do at no additional cost. But beyond 2 years, I think that's a fair amount of time. And then we can say, you know, we did this once, we worked with you with no additional cost. And then, so I wanted to just open up to you and see if you have any objection to just making that small modification from 1 year to 2 years.
Any feedback on that?
I think that makes sense.
No
likewise.
Okay. Seems like there is consensus to make that modification, so we'll go ahead and do that in the draft bill before it comes out. Otherwise, I think everything else, I haven't received any questions from Jenna, so as far as I understand, she understood the edits that we were making, and I've worked with her in the past, and so I think that things are working in the right direction. In terms of legislative items, though, legislature is moving forward on budget reviews more quickly than, to my knowledge, has ever been done. Generally, what has happened in the past is the governor's budget report came out, and then there were at least a couple weeks where representatives from the Legislative Research Department were able to review all that information, put together their summaries of what the agencies have requested, what the governor recommended, and then provide that document to the budget committees. What is happening this year is that while the governor's report is coming out Thursday morning, the budget committees are starting the process to review budgets at least Thursday afternoon, because that is when our report is being reviewed. So I will be in the House Higher Education Budget Committee on Thursday afternoon at 1:30, and we will have the budget reviewed by the KLRD analysts with the members of the committee, and then I'll be providing testimony on the budget that was submitted back in September. So I looked at my testimony from last year, and that was January 23rd, which I believe was the earliest that had been done before. So generally it's the first week in February, so we are really ahead of schedule historically. But you know, the information can be provided, and if they have questions, happy to work with them. So, but I think last year, one of the items of concern from the budget committee, at least certain members on the committee, was the balance in the BSRB fee fund and whether the board could take a look at adjustments to fees any further. And I'm happy to report back to that committee that the board did vote to lower those fees. And so I think that'll be helpful reporting back to that committee when we meet on Thursday.
Hey, do you think, given the amount that's still in there, that would be a concern for them? I mean, it's dropped somewhat, but
you know, it was down to about 1.8, and then currently right now we've just received more revenue than expenditures, which is a little unusual so far for the year. But part of this has been a couple of the multi-state compacts have not become operational yet. We haven't seen the full impact of those. The professional counseling compact, I think they were optimistic it would be operational by the end of this previous year, and we're still looking at that being operational sometime in late 2025. The social work compact, that group is meeting in terms of getting that operational, but The time frame based on these other compacts, I think we're looking later than we had previously estimated based on. So I think people will ask about that, but I think, one thing that we had also done is absorb some of the salaries when we added a couple staff members. And we said that we would absorb it without increasing any fees and then review that in a couple of years. And so I anticipate questions, but I don't expect we'll face the same opposition. So that'll be happening coming up this week, and I'll keep you updated. The legislature does broadcast the budget committee meetings, so if any board members would like to view those meetings, they're welcome to do so. And those are available after the fact as well, sort of like our meetings for the BSRB. Concerning other items from association meetings, for the Association of State and Provincial Psychology Boards, we had our last board meeting right after I had attended that conference with board member Linda Heisman, and there were some discussions concerning the proposed bylaw amendments and the ASPPB board's previous decision to require passage of both the EPPP and EPPP2. And what I had informed the board last time was the big takeaway was basically the ASPPB board reversed their decision to require both tests as a condition of licensure that was going to go into effect January 1st of 2026. As an alternative, they basically said we're going to be putting together a task force this spring to have individuals work on integrating parts of the two tests together to make one more cohesive test. And there are still a couple of other items to be, I think, worked through in terms of that association at the national level. So I've added an item to the agenda to kind of discuss a possible direction that we could go working with some other states in terms of that association. But I'll go ahead and hold some of those comments until we get to that item on the agenda. In terms of the other associations, I did attend the national meeting of the Association of Social Work Boards. That was the week after the last board meeting, and I attended that with board member Cynthia Schindel. And I would say that there were some really positive updates from that meeting, specifically about the licensing test for social work. The problem is some of those updates were in a confidential session, and they have told us that this spring they're going to be putting out information about some of those changes and updates, but they've asked us not to talk about it publicly until that information is available in a way that we can distribute. So unfortunately, I can't comment too much on those items, but the information I did hear was very positive. And Cynthia, do you have any other comments from the annual meeting of ASPPB?
No, I just, it was really helpful to talk with regulators from other states, and in hearing what some of the issues that they're dealing with, it really made it clear that we're a bit ahead of the game on a lot of the issues and concerns. And it was good to be able to share, some of our issues that we've already resolved and that we have policies and procedures in place for. And I think it was helpful to the people from the other states to hear about those too.
Yeah, I agree with that. Specifically, it's really interesting. I don't know if all of you hear this, because a lot of times we work just within what we know in terms of the state. But at the national level, there is a trend, and when you get one dot or two dots, you can't always tell if it's a line. But we're seeing several dots now that states are moving towards a concept that is like the BSRB, where you are having, not a separate social work board, not a separate psychology board, but if you can combine a few different boards have a similar connection, like mental health or behavioral health, you really do benefit from the efficiencies and being able to have staff take care of things, like clerical staff, investigative staff. And so I've been working with different representatives from states like Utah that has moved to that composite nature recently, and Iowa, who's not only moved to a composite nature, but they're also developing things like the advisory committees as well. It makes me think that someone was specifically looking at Kansas, honestly, because it looks like almost a mirror of what we have here. And part of this may be that, when we go to National Association meetings, some agencies from other states are basically saying we're struggling because we have so few licensees that our board members are the ones physically reviewing the application, or they're the ones making the phone calls for investigation. And to me, that, it's wearing too many hats. It's so much cleaner if we can have things in a more structured and separate way. So It's also been nice, I've been in my position now for 4 years, and when I first came on board, I was a sponge, and I still try to be, learning what other states are doing. But early on, I was reaching out and saying, oh, I would like to know, how you solve this issue and how you're doing this. And now in the last year or two, it's been kind of a change of conversation where states
Right.
are saying, we would really love a solution to this issue or that issue. And we're like, we actually have a policy on that. We'd be happy to send that to you. And so it's been nice to hear from them. And so I think at a national level, I think we're really respected as a state. And I think our system is really really want to communicate that back to you and the positive feedback that we're getting.
And I would all just add to that David serves on the finance committee, I think, is that right?
That's right.
For ASWB, and I know you're also have some roles on some of the other national organizations, and I think that really shows Kansas well, and is the reason that we have other states that are looking to us now as they change some of their and trend in that direction of multidisciplinary boards.
And just to let you know, I've mentioned this a couple times, but I'm trying to be very selective. I want to help out, and I feel like I'm at a good position now to where we can start to contribute back to help individuals from other states. But I also don't want to shortchange all of you as board members. My primary commitment is as executive director here. But I do feel like there's a healthy balance that can be reached. So I've been volunteering for committees, and there have been people that have at times made comments about saying, would you consider running for this board or that board? And I've really been trying to be very respectful, because I appreciate those compliments. But I also make sure that the time balance works out too. So, but I think, serving on that committee has been eye-opening, and it's been helping me learn things and have better discussions with members of their association. And I'll be serving on that committee again this year. And I think there's some more work for us to do in that committee. And I think that could help out licensees and if we push a few things. So can't really talk too much about that because we still need to meet and hopefully get some traction on some of those items, but happy to move forward. In terms of another association, there's the American Association of State Counseling Board. That group is holding their annual meeting coming up on February 9th through 11th. So I'll be attending that meeting with board member Laura Shaughnessy. I do serve as the treasurer for that organization. And it has been good professional development, honestly, for me to learn how to look at certain finance sheets a little bit deeper. I have previous experience working with a lot of those topics with, I spent 8 years with the Legislative Research Department, primarily as a fiscal analyst, but looking at it from a different perspective as a nonprofit association, it is helpful to kind of learn some of the different rules and hear some of the reasons why certain things exist the way they do. So I've been trying to add some value there, and while I'm trying to be part of those discussions as well. So, but I will be attending that meeting coming up, and then I'll report back to you items from. In terms of some other items, there is an item on the agenda coming up that deals with the Kansas Fights Addiction Grant Review Board. And when we get to that item, I'll provide a little bit of history in terms of how that group was started. And Jason Hess is in attendance on the Zoom. He's the board's designee on the review board, and he can provide a little bit more information in terms of the work of that group and his work as the board's designee to that group. In terms of the other entities, there are 3 multi-state compacts that Kansas is a part of. After the last board meeting, I attended the annual meeting for the SciPac Compact, which is a psychology compact. That was November 17th through the 19th. And I'm happy to report that multi-state compact is self-sufficient now. It is fully functional. It allows psychologists that have a home state license to apply to the SciPac Compact for the ability to do telehealth services in other states while they are still in their home state. It also allows them to apply separately for up to 30 days of in-state practice in other compact member states. So happy to I've served as commissioner for that since Kansas joined that compact. But now that I'm serving as a commissioner for the social work multi-state compact, I informed them that as of after the annual meeting, that role as commissioner would be transferring to board member Richard Nobles. So Richard, really happy that you're taking on that responsibility as commissioner, and I know you'll do a great job with that. And Richard and I have already started having conversations with people when they email the BSRB in terms of questions on SciPac. So that commission is fully functional. It's working out really well. there is still, I think, some room for improvement. One of the items when they established that compact was they put in an assessment to the state to essentially charge the state per person that practices under that compact. And it's essentially a fee that we pay at the end of every year. But based on the finance sheets, I don't believe that compact really needs that funding from the states any longer. I think they could be fully self-sufficient without charging the state that fee. So I did ask questions about that to see, because currently right now we pass along that fee to our licensees who practice under SIPAC. But if that fee is no longer being charged to us, there's no reason for it to charge it to our licensees. So they did tell me that they are not interested in changing that this year, but next year they'll take a good look at it to see if they can remove that as one of their funding. Professional counseling multi-state compact, that they're going to hold a meeting the day after the AASCB meeting in February. So Laura and I will be attending that meeting as well to learn updates on the counseling compact. Their data system, I believe, is still under construction, but they're hopeful that they can start issuing those privileges at the end of 2025 or sometime maybe a little bit earlier in 2025. And then for the social work multi-state compact meeting, the next meeting is going to be February 4th through 5th, and that'll be in Lexington, Kentucky. So I'll be attending that meeting in person and trying to work with the commission to help them get their rules all in order. The next step will be putting out an RFP for the data system, or seeing if they can piggyback with the other compacts in terms of the data system to see if they can, share those utilities basically. And so that'll be a decision for that commission, but I'll be attending that meeting at the beginning of February. So as you can kind of see from the rest of my report, we've been pretty active with a lot of other meetings, but I'm not going to go into those. If you have questions, feel free to ask me about any of them, but I just kind of like to give you an idea. I know that some of you, lots of you have other items and other committees that you serve on. And so a lot of the work that we do here in the office, it may not be seen in the same way that the meetings are, but I want to give you an opportunity to kind of see all the different ways that we're trying to make improvements and do outreach. So if you ever have questions on those items, feel free to let me know. So with that, I'll go ahead and end my report and see if there's any questions.
Any questions for Dave? All right, seeing none, we'll welcome Jason Hess to our meeting. Dave, you wanted to give a little background?
Sure. Okay, so basically, back during, I believe it was the 2021 legislative session, there was a bill that went before the legislature that created the Kansas Fights Addiction Grant Review Board. And essentially what that group was set up to do, it was set up to take the money that Kansas collects as being a part of federal opioid lawsuits. And so in some of those federal lawsuits, different states are provided a portion of those settlements. And what this group was going to be doing was looking at the money that Kansas has received from those and the money projected that Kansas will be receiving in future years, and would set up a process to be able to distribute some of that money out to groups that provide addiction type services. And initially, for the first year, there wasn't a lot of movement for that group once it was passed into law. I served as the board's initial designee, monitoring when that was going to become up and running. And ultimately, that group did come together. There were appointments made by about 12 different entities to have a representative to serve on that group. It is facilitated by the Reviser of Statute Office. And then ultimately, there was a nonprofit group that came on board to help work with the members of that board in terms of facilitating some of those grants and the process to do that. So the board did make a decision to go ahead and open the process up to name a designee who had experience working with addictions specifically. And so we did open that up. We had comments and feedback from a number of the different advisory committees. And there was a recommendation to name Jason Hess as the board's designee. And he has been serving as the board's designee for, I believe, the last 2 years. I think there was an initial decision that designees would serve for 2 fiscal years. And that did come up, I believe, at the June or July meeting last year. And the board went ahead and agreed to have him continue on as the board's designee. So that's a little bit of the history of how the group was formed. And I believe their meetings, at least at some point, were broadcast on the legislative YouTube channel. So if you ever want to go back and see some of those meetings, in the past, at least they were available that way. But I'll go ahead and turn it over to Jason, and he can talk a little bit about the group itself, and maybe your role as the board appointee on that group.
Great. Well, thank you. Thanks everybody for just your faith in me and sitting on that board and representing you and trying to do the best job I can. I do want to start out by congratulating you on your YouTube channel and the 121 subscribers that you have. So you're only about 100,000 away from being able to put a plaque behind David on this video showing that you've made it in the world. So you talked about that earlier, and I had to go look it up, and I thought that was great. David's been trying to get me into this meeting for quite a while now, and I keep coming up with conflicts so that I can't be here. But today worked out really well to be able to come and just have a brief overview about what we've been doing on the KFA board, and maybe answer questions. I'm really, to be quite honest, much better at answering questions than I am at formal presentations. A little bit about me. I have been working in the addiction field for right around 31 years now. And most of that time has been with the organization that I now lead called Heartland Regional Alcohol Drug Assessment Center. We're a statewide organization that operates in just about every kind of community in Kansas that we have. And I've served as the executive director of that organization for just over 10 years now. So I've been around a little while. I was on the Addiction Counselor Advisory Committee for as long as I was allowed to be on the Addiction Advisory Committee. They finally wisened up and kicked me off last summer. So right around the time that I figured out what was going on, I was asked to leave. So I'm thinking you guys have done a nice job in establishing bylaws around that time limit. But we just had a meeting on Friday that I was unfortunately unable to attend. I think that was the first one that I've missed since the time that I was appointed. But we did, as a board, just get done completing the approval process for the second. I call it, our rounds of grants have kind of come in waves. And so we had a first wave with 2 grants, and now we're at second wave with 2 grants. We just got done approving roughly, give or take, $14.7 million in funding for both treatment and prevention for this next year. Now, those are 1-year grants to fund treatment activities and prevention activities and first responder activities throughout the state of Kansas. Our previous round of grants happened and were approved in 2023. And that round that we did, our first grant award went out to roughly 35 different organizations, and we funded a little over $6 million in treatment activities. And then second RFP in 2023 was for prevention primarily, and we funded 24 organizations. A little over $4 million went out for that. And the things that we funded on those, I know on Friday there was a report that came out that, David, I didn't get in time to get it sent to you to give to the board. It's a nice summary, and I'll probably send it to you to send out just so that you all have it, because I think it's a nice overview of some of the things that we've funded over the past few years. So the first round of grants touched roughly just under 80,000 people in Kansas. We added 28 new residential beds for substance use treatment. We distributed a little over 4,600 naloxone kits. There was support for a number of new recovery houses opening across the state. And so I think the money that we're giving out is doing a lot of good. I think and this second round of funding that we just approved here this past fall, which is going to start going into effect in February. Those contracts, the first set of contracts went out and will go into effect February 1st for treatment. And we'll be continuing to fund some additional dollars, some additional beds. We'll be funding some additional abilities to house people once treatment is over. We're funding additional medication assisted treatment for folks suffering from opiate addiction, which is the primary reason for these funds in general. We're funding things like recovery centers and transportation services and case management care coordination services for people in the community. I think if there's one frustration that comes out that I generally come out with is right now we're still kind of in the early phases of funding, and so the one-time grant awards don't go as far or last as long as we'd all like them to go. But we're getting closer to being able to do some longer term stuff in a more creative manner. Every Kansas county so far has had this funding connected to it. There were, I think, 11 statewide awards in the first year, in the first round, 2 rounds of grants, and so we were able to distribute the dollars in a fairly consistent manner across the state. So if we go down to and talk a little bit about some of the new things that we're looking at doing, we did enter into an agreement with the Kansas University Center for I want to say public and private. CPPR is what it is. Anyway, they do needs assessments, and so we are currently funding a needs assessment, a statewide needs assessment, to help us determine the best use of these dollars moving forward. Kansas is slated to hopefully the end result of all of the lawsuits will, over the next, I think 15 years now, we'll be receiving roughly $350 million to distribute across the state. 25% of that will go to municipalities and counties. And so it's a pretty substantial sum of money. There are 5 or 6 lawsuits that are still waiting to be completed. And so we don't know the final tallies on some of those. But they are coming. We're hoping the needs assessment will be completed within the first 3 months of this calendar year. At least that's my hope, so that we can get a better handle on strategically moving forward on distributing these dollars across the state, and targeting specific areas and targeting some creative ways of doing things. Our hope, I believe, and anything you hear from me, of course, is said with the caveat that you have my opinion on all things. The Attorney General's office would chastise me closely if I said anything different. But my hope is that we'll be able to do some larger multi-year awards to maybe establish some programming across in different areas of the state, especially those areas that have been hit the hardest from both fentanyl use and homelessness, and maybe get people some better access. One of the things we focused on, I know in the first round, was how do folks out in the far west reaches of Kansas get better access to services when their closest service may be 2 hours away. And we were able to do a little bit of that. We increased some telemedicine access out there. So that in essence is what we've been looking at. I think the next several meetings are going to be focused a lot on what our next steps are strategically in terms of getting these dollars out. Hopefully, like I said, we'll have a good solid needs assessment that we can dig into. Yeah. So I would welcome any questions that you all might have and do my best to answer them as my limited knowledge allows.
Thank you, Jason. Questions?
I have a question. First, thank you so much for doing the work that you've been doing. I really appreciate it, and I know that the board really appreciates it. You were mentioning that in the second round of funding, there were prevention efforts that you all were funding. What were some of the things that you guys funded in terms of prevention against opioid use or overdoses or whatever the case may be?
Yeah, so that the prevention grant that went out that we just finished doing approvals for back in December, we awarded roughly a little over $6 million to 37 organizations, and it was both a push to get into the prevention realm, but it was also a push to get into the first responder realm. So things like getting Narcan into the hands of EMS workers, providing information for some of the mobile units that are going out. In particular, I think Johnson County, maybe Overland Park has a mobile van that they have going out. So we're funding some things connected to that. And a lot of education reaching into kids. We awarded, I mean, in general, those are the kinds of things. Is how do you get money in the hands of people so they can reduce barriers for people to get access to what they need, or to do some of that pre-work as things are starting to show up, and they can get educated for it. That's in general terms what we approved. And I would point you all, and I know that I always stick this on there, but the Sunflower Foundation is the organization that we are working with to disperse these dollars, and they manage the grants and do all of those things. All of our work is documented on that particular website too. So always feel free to go and take a look at that.
Any other questions for Jason? All right. If not, thanks again, Jason. It's good to see you.
You too, and thanks everybody. Again, I appreciate being able to do this, and hopefully I'm serving you all well. And if you have any questions, always feel free to reach out. I forgot what I tell my staff versus what I tell the community. So we'll see y'all.
Thank you.
Thank you.
Dave, do you mind if I jump back in for
Sure.
a second? And I should have looked at my materials. I included a few extra documents in your packet during my executive director report. There were a couple things I just wanted to touch upon really quickly. In my documents that I provided for you, I mentioned that I'm serving as the treasurer for the American Association of State Counseling Boards. One of the benefits in working with groups like that is they have committees that work on tools that are going to be helpful, not just for us, but for other states. And they did come out with a document that dealt with supporting the safe and ethical use of artificial intelligence and mental health counseling. Yeah. We've had a kind of an ongoing conversation about what role the board should play in terms of AI and helping out with practitioners in terms of, what the standards should be. And they have a pretty good document. It's only about 6 pages long or so, but I think we'll be distributing that to the advisory committees to help them. Feel free to take a look at that. I think it's a nice little document that kind of gives a thoughtful approach to some of those topics we've been wrestling with ourselves. And then also, I try to track regulatory news for different states. And there was something that caught my eye. This is a document, and I just grabbed just the short version of it. It is a document here. It's an article from the Arkbridge Institute. And I admit I don't know that institute very well, but they put together a state occupational licensing index last year in the fall of 2024, basically trying to track and categorize states with the highest occupational licensing burden and the states with the least. And what I thought you would find very interesting on page 3, it says in 2024, the state with the highest occupational licensing burden was Texas, followed by Arkansas, Tennessee, Oregon, and Alabama. But more importantly, the state with the fewest occupational licensing burden is Kansas. And out of the 50 states plus DC, we had the fewest occupational licensing burdens, at least according to their rankings and their reports. They had Missouri right after us at 50. If you want to find out more information about why they came to this conclusion, There is a link in that document to a much longer report. I think it's about 60 pages, so I didn't want to print that for you all, but I would encourage you to take a look at that. Some of this talks about universal licensure. There was a version of that passed in legislature in 2021. They also keep track of, just from a quick review, the number of requirements to become licensed in different ways. But I thought, this does not match the narrative that some people put out there, but it certainly was interesting to me, and I wanted to share it with you. Like I said, I'm not all that knowledgeable about the group that put it together, Art Bridge Institute, but I wanted to make sure that you were aware of this information. I encourage you to explore that report when you have time.
Thanks, Steve. Our next agenda item is staff reports. Start with a discussion on possible regulation for alternative standards to meet completion of postgraduate experience requirements for a clinical license.
Yeah, we can kind of share this topic.
Okay.
So one document you routinely find in your packet is the trend of licensing, and you can see that those numbers are still climbing, which is great. We still continue to see growth in the professions licensed by the BSRB. But we thought this would be a good opportunity to bring an additional item to you. You may have heard the unfortunate news that Professor Dave Provorst, psychology professor at Washburn University, passed away. And we have been receiving some questions from some of the individuals that he was providing supervision to in terms of accruing hours towards a clinical license or the permanent license. And in our regulations for the independent license, it basically says in the statute you have to complete 3,000 hours of postgraduate experience. In the regulation, it provides more detail in terms of how you can meet that standard. And the regulation basically says that your supervisor must sign an attestation. Well, with Dr. Provorst passing away, that does create an issue. And we had talked with legal counsel, Tim Resner for the board, and Lexi and I had reviewed to see, what flexibility we could provide. There are going to be individuals, a fair number of individuals who receive supervision, and they're asking us, how can they meet this standard? And so, and Tim, feel free to weigh in, or Leslie, feel free to weigh in. But one thing that we wanted to bring to you was the concept of perhaps creating some additional language in the regulation that addresses situations like this, so that it does say the standard for meeting that as a attestation from your supervisor, but then to add some additional languages that says if the supervisor is unavailable because of death or incapacity or other reasons, the board is allowed to consider other items to meet this standard, or look at things, in a larger perspective. Currently, that language, I think it's a reasonable approach in situations like this, and we're going to have, unfortunately, we will have this situation come up again in the future, I'm sure. But we need to have clear authority for the board to make these types of decisions and consider other things. So I wanted to bring that to you. And Leslie, do you want to weigh in on this at all? Or?
Yeah, I brought it to Dave because these people are scrambling, and we actually have 2 supervisor deaths just recently. And when they've changed supervisors, we tell them get an attestation and when you apply. And I think that's fair, but they want some kind of acceptance that we're going to count their hours so they know when to apply. And I think, in a death, it's obviously an extenuating circumstance. So I just, brought it to him asking what kinds of information we would accept. So
has this occurred? I would assume it would have occurred in the past.
It did. The problem is different. Well, okay, CAPA proceedings, all the professions didn't used to be under CAPA. And so a lot of information and things like that came to the board at board meetings. Well, you can't take an attestation or hours or something to the CAPA board before, or the proceedings before they actually apply. So that has changed how we deal with it internally. I remember one supervisor was passed away, but they all had signed logs. It was very neat and tidy, and someone else at the agency where she worked was able to look at that and, with that, provide an attestation I just kind of need to know
Sure.
what we can accept, and perhaps while we're doing all of these reg changes in the postgraduate, maybe we could, we don't require that they sign logs now. We say they both have to keep them, but there's no, just somewhere that they have to show consistently that they're doing this correctly, so that if something like this happens, they have proof that they were doing things satisfactorily and don't lose all their hours.
And Tim, I know that you had looked into this topic as well. Do you have any thoughts you wanted to make the board members aware of in terms of this item as well?
Yeah, so I think generally, and Dave, you sort of covered this, but when we discuss this, the burden's on the applicant to furnish satisfactory evidence of the different qualifications, in this case, the postgraduate supervised hours. And arguably, the board has, and this would be my opinion, the board has defined what satisfactory evidence is in the case of the supervised hours, and that's the attestation. And there's not, we don't find any extenuating circumstance or avenue for a waiver in the event that the supervisor is not available to provide the attestation, which really creates an issue. Waiving what's in regulation is never advisable. Certainly things happen, but that sort of is the context for the suggestion here that Dave and Leslie have laid out. Is you don't have a mechanism for that currently, and it's going to happen. It has happened, and it will happen. And so it seems reasonable to put some sort of approach. There'll probably be some guardrails that are needed, but some sort of approach to allow for this type of circumstance when it comes about that the supervisor is not available. And we've given a little bit of thought and discussion to what that could be, but at the very least, I think allowing for the mechanism makes good sense here.
Additional questions or comments?
I just think it makes good sense. I think the only caveat or concern in how we language it would be ensuring that it is a death or incapacitation versus I don't want that supervisor to be the one signing my hours. So I definitely think it's a reasonable approach, though, to have an alternate method in that event of death or incapacitation, or so however that's written. I would trust that language in there.
Something that Joan and I have discussed at length is some states have requirements where the supervisor has to fill out a short form every 6 months or however long. And while I think it would create more work for the supervisor and the license, I might cut down at the end, when people can't find their supervisors, when Joan does a lot of work, trying to deal with oddball situations where, so that's also something long-term that the board might consider.
Would you have them just keep it, or would they have to submit it?
Submit it to the board, or you could have them keep it.
It would reduce the
both of them,
work
yeah,
for you all if they kept it, and then if there was an issue, it was
right.
provided.
And then there are the rare occasions where, a supervisor doesn't speak to the supervisee about things, and then they fill out their attestation and they have all these problems. And I'm like, they shouldn't be surprised by this. So.
Well, I think everybody sounded kind of a lot of head nods, everybody in agreement to create some language for these types of situations.
Okay.
Were there any other staff reports? Nope. Okay. We'll move to complaint review committee.
That we compile each month about the complaints the board receives and the decisions of the complaint review committee. This is the midpoint of fiscal year 2025. I'd like to point out that at this time, we have received 132 complaints, and this is consistent with the same time last year.
So more licensees and yet the same amount of complaints. So do I assume that means that the ratio has gone down a little bit?
Dave, do you want to answer that?
It seems to me in talking with Cindy, sometimes we get complaints that come in clusters.
Yes,
So
there you go.
It's
There's
not
no
that-
pattern to anything. Yeah.
Okay.
It goes up and down. So I don't look at, I try to point out there's an ebb and a flow to complaints. And so if you, not to try to make you focus on anything, but if you look at 1 month, we'll get 8 complaints. This past month, we got 32 complaints. So it's really hard to say, hey, look at this month where we did get 32 complaints and it was very overwhelming. But there's really an up and a down. And so I tried to try to help you by looking at the past 6 months. And so it really is kind of an ebb and a flow, and it's really hard to get patterns because there is none. I'm not trying to gloss over anything. The only thing to look at another overview is it does seem to be they are becoming more complex. To even they're larger and they're just even reading them can be more complex, but the number of pages, just every single part of them seems for us to be more complex.
What do you make of that?
We don't know. It just just on a day to day, it just seems to be overwhelming.
Wow.
Just like Joan, who has for those of you who don't deal with her every day, is incredibly competent. She's a very competent individual, but she was just overwhelmed with copying something the other day, and she just said it just took her a long time to try to sort out this complaint and what it meant and who it was regarding, and that's just what it seems. And I would just maybe add also that we're getting more perhaps regarding people who are unlicensed. And that would be, although I said nothing, there's no trends, that seems to be an increasing trend. That we seem to get more about people that are unlicensed. Either they were never licensed or they're unlicensed in another state or they are another profession.
Well, and for some of the unlicensed people, it will take our staff longer to check that. Because previously, if you were practicing in Kansas, you were licensed in Kansas. Then now with these multi-state compacts, there will be people that have other authorizations to practice. So before we can say this person's not licensed here, we need to double check and see, are they authorized to practice under SIPAC? And then we could do our own investigation, or their home state could do the investigation. So it's more complicated. There's going to be, it just kind of depends on some of those factors, but.
Yeah, anecdotally, I would just say I agree, Cindy. I think the complaint review committee gets larger files to review, I think, every time. A couple of questions maybe that's coming to mind. I think off and on the board has requested sort of how can we get some data on time from receiving a complaint to maybe disposition of the case or dismissal. So is there any movement on being able to see some report data on timeliness or?
Not this meeting.
Okay.
Well,
I wouldn't expect at this meeting. I just said, could you go there?
Yeah, but we will work. We'll work on it. From average time from receiving it to when it is disposed of.
Yeah, I think that's one of the things we kind of looked at was, are we getting caught up? And I know the complaint review committee has done a tremendous job of ensuring that we're staying on track with the cases and even doing additional meetings to make sure that happens. So I really appreciate the effort on that. But from the licensee perspective, certainly they're in a holding pattern until there's a disposition. So
yeah,
thank you.
Definitely we'll work on it. Anything else?
All right. We'll move to professions reports, licensed psychology.
So the Licensed Psychology Advisory Committee, we met on the 10th of December at 6 p.m. and we had a number of items that we fielded during the meeting. We heard public comment from Dr. Jason Malasek, and he is the president of the Kansas Psychological Association, and he presented public he presented publicly about advocating for the elimination of the postdoc requirement for psychologists in the state of Kansas. And as I am remembering, that was a really fruitful discussion, and individuals on the committee were in favor of doing so. We also had a discussion a lot regarding allowing for other professions to supervise psychologists, and that was also met favorably by members of the committee. We discussed, kind of going back to what David had said earlier, we had a discussion about the ASPPB finding, and that we will not be implementing the EBBB2 as it was proscribed for January 1, 2026. And a fair bit of time was taken by our annual training, and we completed half of it, and we'll complete the other half of the annual training for advisory committees on Tuesday, the 11th of February, 2025 at 6 p.m.
Thank you. Social work?
Yes, the Social Work Advisory Committee met on December 10th, and we reported on the ASWB annual meeting that David and I spoke of earlier. We also spent some time reviewing the advisory committee's recommendation to reverse the amendment that had changed the language for clinical social work experience in getting their clinical license. We had met, David and myself and Andrea had met with several representatives of KNASW in the hopes of finding some common ground on that issue, since they were behind that amendment that got passed. And unfortunately, we're unable to reach any agreement about that issue. And so the recommendation of the committee was to hold off on proposing that. There was not a lot of confidence that we would be able to get that through. And of course, anytime you open up the statute, you're in danger of people adding on amendments, which is exactly how that happened the last time. So at this time, the Social Work Advisory Committee changed their recommendation and suggested that we hold off on including that in our legislative package. We also did the first half of our annual training, and we'll complete the second half next meeting. And we also reviewed our social work supervision manual revision that a few of us have been working on. And hopefully we'll be able to finalize that in the next month or two. Our next meeting will be Tuesday, February 18th.
Thank you. Professional counseling.
Good morning, everyone. We met on December 12th. The advisory committee met then. Well, we spent a lot of our time discussing the compact. The compact obviously will go into effect within the next year, but we had a lot of questions about, what are some of the things that are that we're really working to resolve, so the compact can go ahead and happen. A lot of the educators really want to understand the impact of that so they can pass all that information on to their students, because they have a lot of graduating people who are very anxious to become a part of that. We spoke about the language for the website, counseling language for the website, and we're working on that. We talked about AI, technology, ethics, that big conversation that we will keep visiting and discussing so that we know how to respond and lead and follow that at the same time. We talked about supervision and the change in our supervision to half of the hours being required to be provided by a counseling field and half can be from other folks, other professions. Trying trying to think of anything else to add about that. And then our next meeting is on February 19th. Thank you.
Thank you.
Thank you.
Master's level psychology, the LMLP LCP advisory committee met on December 4th. We too did half of our advisory committee board member annual training. Long discussions about modification to some education regulations, which we'll talk more about in more specificity later in this meeting. Our next meeting is February 7th. Marriage and family therapy.
Marriage and Family Therapy Advisory Committee met December 13th. We completed our annual training in that meeting. Some of the other items, we continue to discuss the changes that were recommended through the Professional Counseling Advisory Committee for supervision. Marriage and Family Therapy Advisory Committee weighed in again on those and hold fast on the way the regulation is currently written and will not be putting forth any recommended changes. We did also have a small discussion on AI as a continuing working topic in our group. I then brought up what topics we want to talk about for 2025. Next meeting is February 14th.
Thank you. Addiction counseling.
The Addiction Counselor Advisory Committee met on December 4th. We welcomed 3 new advisory committee members to our group. We also completed our annual training. We had a meaningful discussion on recommendations to the board about the creation of a student temporary license. That is ongoing. We're still working on that. And we will be discussing in the future AI and adding descriptions of our profession to the BSRB website. Our next meeting will be March 3rd.
Thank you. Behavior analysis.
Yeah, we met on December 13th, and we spent the majority of the meeting talking about the possible survey that we're trying to wordsmith and make sure captures all of the information that we think is important to our field. That took up the majority of the meeting, so we did not complete any of our annual training, which will be conducted at our next board meeting, which will be held on Friday, February 14th at 1 o'clock.
Very good. Thank you. We're now scheduled for a short break. Let's plan to be back at 11:50.
Justin.
Yes.
Ready?
They great.
All right, welcome back, everyone. Get back to our agenda. We're ready for old business and an update on proposed changes to regulation.
Okay, we'll start first with an item in your packet of material, and that is the continuing education updated draft regulations. We talked about these a few times, but one of the items we went through last year with each of the advisory committees was reviewing the language in your continuing education regulation. 3 of the professions had recommended reducing the total number of hours, which we are able to do in regulation. So that has been taken into account. Leslie had also gone through and synced up the number of hours required based on the changes if there were for different professions. We had also gone through and recommended some changes that were adopted by the advisory committees in terms of updating some language, in terms of, you know, video recordings and audio recordings versus videotapes and audio tapes. Removing some language that talked about the, you know, there's also some regulations here that are documentation of continuing education. And there was previously some language that talked about needing the original signed copy to prove certain hours. And with the digital age, that's no longer really necessary or sometimes even available. So updating some of that language, making some of those changes, basically goes into the packet before you. So we just wanted to bring this back to you and see if there's any questions, or if not, if you could go ahead and either by consensus or by vote approve these to move forward, we can submit these for changes out for public comment.
I want to make one additional. Some professions at the very end of the CEU regulation says they have to keep their documents. And I updated them all so they say for 3 years following a renewal, so that if there's any question about, we've had complaints before where people said they didn't really take a class, or and some professions had it, so I made it uniform for everyone.
So record retention of 3 years after your renewal.
And there's also we talked a little bit about a self-directed learning project that was previously included. No one really uses that to qualify for hours or has any frequency. And so a lot of the advisory committees, I think all of them had made the motion to go ahead and remove those. And so that deleted as well.
Very good, thank you. Any other questions or comments? Do we have consensus to move forward on that?
Yes.
All right, very good. Thank you.
Okay.
Unprofessional conduct.
All right, so this is the next large packet of regulations you have in your materials. This one is a little bit more complicated. Basically, you may recall a couple years ago, we had each of the advisory committees review the unprofessional conduct regulations for their profession. Some have not been adjusted in about 20 years. So it was definitely something that the advisory committees needed to weigh in on, see if there was updated language, if items needed to be removed, if there were anything that was missing. So we had each of the advisory committees look at these separately. There were recommendations made by all the different advisory committees. We brought this back to the board, combined them into one document. And there was a decision at that time to return the combined document back to the advisory committees, so the different advisory committees could see what changes each of the other committees had recommended, to see should we adopt that for a particular advisory committee or not. And so there was sort of that peer comparison, and some of the advisory committees recommended additional changes. So what you have here is essentially all the recommended changes through all of this process. And I want to thank my staff members. They helped me go back and kind of collect all of these edits and bring them to you. So they are all here as well. With that being said, I did want to bring a couple of items for discussion to you. In looking through the unprofessional conduct regulations, while they don't have to be uniform by profession, it may be helpful for the board to consider taking perspective, or at least having a discussion on a few different topics. So I don't want to put this on to you today, but I do want to bring this to you to say perhaps between now and the next board meeting, you may want to consider whether you want to adopt these changes as they are, or whether you want to make an across the board change for all the professions based on a few different ones. One of the topics there, most of the professions had a separate record keeping regulation that dealt with unprofessional conduct as it related to record keeping. However, two of the professions, master's level psychology and professional counseling, did not. So when you're flipping through here, the professions that did have a separate regulation, one of their decisions was to roll that into the main and professional conduct regulation. But I think something that you could consider would be basically to adopt similar language for the professions that didn't have a second. There are some references to records, but it's not uniform right now between professions. So that's one option you could take. Additionally, there's a topic that got a lot of discussion by the advisory committees, and that had to do with unprofessional conduct as it related to licensees having sexual relations with clients. The current standard in the regulations is that licensees are not to have sexual relations with clients after that relationship is terminated within 24 months. So there's a 2-year standard. Some of the professions have discussed and recommended a change to say that it is never acceptable after someone's been a client. So what we have now with some of those advisory committees making that recommendation is you have a little bit of an inconsistent standard by professions. Like I said, you don't have to have uniformity on that issue, but I think this is something I wanted to bring to you as board members to think about, to see if you would like to maybe have a discussion at the next meeting and say if that's something you would like to be consistent with the professions, or if you want to allow there to be some differences by the advisory committees. Another one has to do with some differences as it relates to some new categories, such as social media. Some of the advisory committees chose to adopt some new language, specifically as it relates to confidentiality in relation to using social media as a professional tool, or what information could be shared. So there is some difference there. But as I mentioned, there doesn't need to be uniformity, but that may be something where you look at the different models the advisory committees have recommended to see, would it be helpful to have a uniform standard between the professions on some of that language or not. There is also some of the beginning language for some of the regulations is a bit different. So we could standardize that if that would be something that would be helpful. Another topic that a lot of the advisory committees had a fair amount of discussion on has to do with a regulation that says unprofessional conduct to discriminate against a client for certain reasons. And right now there is wide variation between the different things that you can either say a licensee is not allowed to discriminate, or it's unprofessional conduct if you do that based on these different factors. You could look at a uniform standard. Alternatively, another option that I was thinking about is you could say it would be unprofessional conduct to discriminate against a client pursuant to the ethics of the profession. So that would be sort of uniform language. But if someone was trying to bring that as unprofessional conduct, they could bring forth standards for a specific profession to make that case.
Would be a nice edit. That would be a yes. Yeah.
And
like that.
And there is some precedents for using that language. Right now, when someone is forming a LLC, a professional LLC, one of the things, if they have a clinical level license, the BSRB is asked to provide a certificate reviewing and approving the name of their company. And there's a lot of deference that we give to them, but there is language in there that basically says the standard we're supposed to use is that the name of their entity is not contrary to the ethics of the profession. So that term is already in statute for another instance. And so if they were to ask us why we use that term, I think there is at least some precedent somewhere else of that. And I think it would help resolve some of the different, regulations, make them more consistent. That is something to consider. And then also there is some language that deals with use of alcohol or drugs by a practitioner, or whether that is impacting their ability to provide services. And that unprofessional conduct regulation, some of the staff members cited there being some different language across the professions on that item as well. So if you wanted to have consistency with that, that would be something that could be considered as well. So I just wanted to bring to you some of these things for the continuing education. I thought those were ready to move forward. For the unprofessional conduct regulations, I know the board has spent a lot of time on this, and I definitely want to help you move forward with these, but I do feel like when these do get changed, we want to make sure that we change them in a way that they won't need to have another revision come up right away. So just wanted to highlight some of these items, but what I would ask the board is maybe between now and the next meeting, review these and decide on some of these key issues. If you would like to have the different professions have separate language, or if you'd like to have some uniformity between these, or maybe some items that I didn't mention.
One quick thing, and or with the psychologist's piece of this, we had decided, I believe, if I'm remembering correctly, to make it such that it would be inappropriate and unprofessional conduct for a licensee to engage in any sexual or physical intimacies. It's still written here as within the past 24 months.
Richard, I appreciate you bringing that forward. I'll double check the minutes from the past meetings. It is possible that as we were going through and looking for that, we missed that one. So I'll go and double check that. If that is, if I can't find a reference to that, that is still something that could be cleaned up at the board level. But I'll go and double check and see if I can find a meeting where that was in the minutes, the recommendation.
Okay, thank you. I appreciate it.
So just for clarification, you're not wanting us to take anything back to the advisory committees. Your recommendation is that we read and review and as a board make the final decisions at this point.
Yeah.
Okay.
I
just
think,
want to make sure I heard that correctly.
yeah, I mean, you know, the advisory committees are really helpful, especially in these discussions. And there's been a lot of discussion on these different, but ultimately, you know, you as a board really do make the decisions for the agency itself. And so I think we've had a lot of really productive dialogue. But I think rather than return this to the advisory committees again, I think we have all the input from the advisory committees. Now it's time that the board get the opportunity to make a discussion. Should we allow there to be some differences based on these different things, or should we have uniformity? And it doesn't have to be across the book. It could be that some of these are going to stay different and some of these should be the same. But I did want to call these out, at least a few of those things. And I know there's a lot of different regulations in here. So there's two different numbering on the page numbers in the middle. It's the page number for the specific regulation for the entire packet. I put a different page number at the bottom right corner. So if you want to reference this packet in the future, that's one way to do it.
Thank you, Dave. Next is expedited.
I'm sorry, I have a quick question. It's Linda. So like when we're going for uniformity, they all flow in the same way, right? Where it starts off with like practice competency, and then impaired judgment, and then dual relationships. So do they all track consistently across the disciplines?
No. That is something, if we were going to do this perfectly, that is something also we could come back and fix as well. I think one of the difficulties is some of the professions have some things grouped, other professions have something separate. There may be value in keeping them separate right now, because historically we may have references to what violations tied to which number. So if we did a reorganization like that, for tracking purposes, it may be difficult to look back and say, we have this many violations of this regulation.
Yeah, that would take something like saying it was this violation in parentheses, formally this number, regulation number, right? Yeah. Okay.
So you know, there are probably some categories that are included in some that are not included in others, but that is something also the board could take a look at. If you're doing a final review and you say, you know, this topic is not in this profession, but it is in the others, and for uniformity, it should be added at the end. That's something else that could be done.
Yeah, I just remember when we were putting these together, none of us were very experienced at developing this. And then you see what some other professions that are longer standing have in theirs, and you're like, oh, maybe that should be in ours as well. And so I just think there's utility in this exercise. It would just make it easier if they were all in the same order.
I know, I agree. If we were starting them from scratch, I 100% agree.
Yeah.
It's
Okay.
just, but yeah.
All right, thank you.
Very good, thank you. Anybody else? Comments? Okay. Expedited application review process.
Okay, so this is a topic that there was legislation that was passed that directed the board to establish an expedited application review process. And there wasn't a lot of guidelines or direction in terms of how that would be established. At the time, we reached out to representatives from other state agencies to say, the legislature has put this in for the BSRB. We'd like to go ahead and be consistent with what other states or what other agencies have in the state of Kansas. And based on the feedback, we didn't get any response that there was this for other states or other agencies. I put it out there for comment from a lot of other people who do what I do in other states. And that we wanted to be consistent, or at least maybe learn from the example that other states have for an expedited application process. And at least the feedback that I got was no other states that I talked to had something like this. So this was very challenging. But we have come up with, based on conversations with the board, basically a model that I wanted to present to you today. And I'll just kind of walk through it, because essentially what we will need eventually will be a regulation for each of the different professions, because there's not regulations right now just for the board in general. This would be something that we would have as an extra regulation for each of the different professions. But what it would have, at least under this model, would identify 5 different license types. There would be permanent licenses, temporary licenses / community-based licenses / temporary candidacy licenses. There would be reinstatement temporary licenses, student temporary licenses, and then temporary out-of-state permits. So we thought we could basically define this as the 5 different types of licenses, and then the standards that would have to be met to have an expedited application for those. And so basically what it would say, the regulation would say an applicant for, let's say, the permanent licenses. An applicant for licensure may apply for an expedited application only if the following criteria can be met at the time the application is provided to the board. And in this case, if they're applying for an addiction counseling license, the applicant can demonstrate completion of at least a bachelor's degree from a program or program accredited by a national accrediting body recognized by the board. If the person is currently registered, certified, licensed, or licensed as an addiction counselor in another jurisdiction, the standards for registration, certification, and licensure to practice in another jurisdiction are substantially equivalent to the requirements of an addiction counselor in Kansas, where the applicant demonstrates that the registration, certification, or licensure to practice as a licensed addiction counselor with a similar scope of practice, and they've held the license for at least 12 months immediately preceding the application. That comes right from the statute that talks about reciprocity. That would be something that they could demonstrate as they're providing their initial application. They would need to demonstrate the absence of disciplinary actions of a serious nature brought by registration, certification, or licensing board or agency, that they have not violated items in the relevant disciplinary statute that basically talks about, not having committed a felony or different crimes or things like that. That they are not under investigation by a regulatory board or other entity in another jurisdiction. And in addition to paying the application fee, they would pay the expedited application fee. And then there's some language that would say if the board determines that any of the following criteria are not met at the time of the application, the board will continue to review the materials necessary to evaluate the applicant, but it will not be subject to the statutory time frame for expedited applications. So basically saying, if you are submitting this, according to the statute, it says if someone pays the fee and asks for their application to be expedited, the board would need to make a decision in 15 days. So for us to be able to meet that time frame, they will have to be providing this at the time that they apply. But this language here would say, if they don't provide that at the time that they apply, we will still go through the process to review their application. We're just not held to the statutory time. This would tie very closely to what's required for these license types and the statute and regulation. Also, in terms of the second part of the regulation, it would define decisions by the board. So according to the language in the statute, it would say, if you do this, you will get a decision by the board within 15 days. So I think within that, we have the ability to define what a decision is. So we discussed this, basically came up with 5 different types of decisions that we could define in the regulation. 1, the applicant is approved for licensure, subject to paying the initial license fee. 2, the applicant is approved to take the licensing examination. That would also be a decision. 3, the applicant failed to submit a complete application in accordance with the standard in the regulation, and the decision is a presumptive denial at this time due to an incomplete file. 4, the applicant did not meet the criteria for expedited licensure in the regulation, so a presumptive denial is appropriate. 5, due to the discovery of a disciplinary issue, additional board investigation is required prior to a determination of the qualifications for licensure, so the board will make a presumptive denial without further investigation. This term presumptive denial is basically, I think, something that is helpful, because for there to be a full denial, that means that we basically have had the board agree this should be a denial and a legal order is drafted by council. There's no way to meet that 15-day time frame. But if we decide to define the definition of decisions, we could define these ones as, here are situations to where we can give you a decision that you're licensed, that you can take the test, or here are situations where we would say you don't meet those standards and the decision is presumptive denial. And then it would also say the applicant will be asked whether they would like the presumptive decision sent to the board or for the opportunity to address the issue if they are not approved for license or approved to take the licensing examination. If the applicant wishes to submit additional information or allow time for additional investigation, the board will work as quickly as possible to revise the decision with new information, but it will not be held to the expedited licensure time frame. So what we're trying to do is we're trying to meet the intent of that statute, but there's no way feasibly for us to have a legal definition with all the rights for them to request an appeal. So what we will say is we'll define the definition in this way, and then if the person really wants a decision, yes or no, that will be sent to the board for the official denial. We will define a term of presumptive denial based on the board review, and then we can kind of move forward. So this is very much outside the box, but we were asked to define something outside the box. So I wanted to bring it to you and get your thoughts and see if you thought this might be helpful, at least in providing a possible workable process for you.
I think you've done a really admirable job of trying to kind of meet the request, but do it in a way that, you know, balances the needs of the agency so that we don't end up just doing a bunch of denials, which is what would happen if people had to have an answer in 15 days and they didn't provide that. So I think you've done a great job with that.
Is there anything from the connecting point of, I have a presumptive denial but I'm still eligible? Is there any other language or process or piece that needs to be considered so that you can continue to look at an application and see if they're suitable for license? I'm just trying to think through when you're going through those scenarios, what could happen?
I think if we come to the position to where we think it'd be a presumptive denial for one of the reasons, we would reach out to them and say, based on you submit an expedited application with the standards that we have to follow, it looks like a presumptive denial based on these factors. If you would like us to continue working through your application, we're happy to do that, but you have the right for us to bring it to the board, for the board to make a decision right now if that's what you want. So we would give them a choice.
So practically speaking, looking at it from the staff perspective, you have a stack of applications that you're looking through right now, right? And you get this expedited review request. Does that go to the top of your pile? And how does that affect then all the other work that you're currently looking at?
It would slow it down.
Yeah,
And
it slows it down for the other applicants.
yeah, this is not something that was driven by the board. It was something that advocates had wanted to have added. And also, in terms of the process you described, it's very rarely what we actually see. Very rarely do we actually get everything to make a decision and review. So it's really not a stack. We usually get the application, and then sometimes they pay the fee at the same time, sometimes they don't. Sometimes they have references, sometimes the references follow the transcripts, sometimes they're sent later. So I think for us to make this time frame work, we basically need to be upfront and say, look, if you want it to be considered as a stack, we need to have the staff
Mhm.
and stuff.
Well, even just not staff, but you still have your work that you're doing,
Right.
right? And it's not a staff necessarily, but you still have the work and then, and now you have somebody coming and saying, put me on top. And if you have like a lot, and I have no idea how much that will be, then everybody else sort of. Yeah.
I suppose the upside of our budget situation is if we needed to add staff to do that. We have the ability to.
Yeah, we have funding right now that we could bring in temporary staffing to help us at times when things are really busy. So we could do that. And right now, I think one of the unknowns is how many people will want to use this.
Right.
You know, we are certainly not encouraging people to do this because we are uncertain how much value we can add in this process. Most of the time, we issue decisions on the same day we receive the last item, but we were really trying to fit the spirit of the statute. And like I said, this is a totally outside the box type thing, so we're trying to make it work.
But there's no additional cost to request it.
There is.
It's $100, isn't it?
It is.
Right. Yeah, because otherwise I think everybody would have done it, right? We'd have been
Exactly.
right back into what you were saying.
Well, and it's a non, you know, our fees, the fees we collect are non-refundable. And I don't want to be collecting fees from somebody if I can't provide them a service. So I want to make sure that we have something in place that we can actually do that's going to add value.
Yeah, that was the original discussion, right? That they would pay, get this, and most of them would end up being denied. Couldn't get their money back, so we would be, so I think this is a really nice balanced perspective and they understand everything they need to put in up front. It could be, I mean, it could be really helpful to get everything all at once and just be able to review it, and as you said.
It's what we request of all applicants, but they just don't.
Well, references,
Yeah.
things, you know, some of that's a little.
Yeah, no, it would be very nice to get complete applications.
Right. Now, one of the tricky things as part of this is the documentation of their educational qualifications. We require that to be sent directly from the school. And so that may be difficult for them to provide unless they think that up and have the school provide it within the necessary time frame. We did talk about an alternative. You know, I'm not saying that I recommend this or that's a good idea. There is the possibility of, you know, accepting a student provided transcript. Right now, we accept it only from the school or if it's sent directly from the school to another service that provides it to us. So I think probably to make sure we don't have people attempting to commit fraud, it's probably best to continue to do what we're doing. But that is something that is going to be tricky because we can't receive that directly from the student currently.
Or that they be allowed to send an unofficial transcript that we can start the review process, but we have to receive the official transcript before the license is issued. Which would be within that 15 days. But that would, and I think that also we can make clear on our applications and the instructions that transcripts can be sent ahead of the application. Because people call and ask us that, and if it's here, if they request it ahead of time, then that would help them.
Yeah, because it's one thing they can't generate themselves.
Right. And the verification, but we can usually do those.
In terms of a rough estimate, and I realize that, you know, these numbers fluctuate, how frequent is it the case that the thing that's holding up an application is the transcript?
It happens. I mean, it's usually not, because most schools allow them to do it online. It doesn't usually hold them up too long. But when they request, they get mail. Sometimes they don't come. So if we really push for digital transcripts to be sent by email, that will help. And when they do that, we usually receive them within a few days.
Okay.
Any other comments? Do you need anything else from us?
No, we'll just go ahead and start putting this together then. So
Yeah, I think that's really good work. I mean,
thank you.
Professional counseling, privilege fees for out-of-state individuals seeking to practice under professional counseling multi-state compact.
Yes, so we had already talked through the fee adjustments and the regulations with all of you last meeting. There's one additional item in going through preparing for the professional counseling multi-state compact to become effective. When that bill was passed, there was an amendment to add a $25 home state privilege to practice for that profession. I believe it was passed because it was very similar to what was passed for the SIPAC compact when that multi-state compact was passed. The difference is under the SIPAC compact, people are basically, if they practice under that compact, they have to have a home state license, and then they apply to the SIPAC Commission for the ability to provide telehealth services in other states. The SIPAC Commission, as part of their funding stream, looked back on Kansas, and it says this many people with a home state license in Kansas are practicing under SIPAC, so we will charge you $10 per person per year. And so they give us an assessment or a bill, and we have to pay that every year. So one of the reasons why this was put in for the SIPAC one was essentially to try to make us whole with that compact fee. For the professional counseling profession, we did not know how they were going to be funded at the time that bill was passed. What they have decided as a commission is that rather than charge states something similar like an assessment, they are going to be taking their operating fee directly from individuals when they want to get a privilege to practice. So the way professional counseling multi-state compact works is you will need to have a license in your home state, but instead of getting authorization to practice in different states through telehealth, like the psychologist, they would need to apply to the compact commission for a specific privilege to practice in each individual state that they want to practice into. And then each state has the ability to define how much their privilege fee is going to be. So it's really not a home state privilege to practice for our licensees. We would never charge the people that have a home state license. We would only be charging people that are outside of them. So really the way that it's defined, the regulation doesn't really fit the model. So what we need to do is we need to come up with an amount that we would charge out-of-state individuals wishing to get a privilege to practice in Kansas under that professional counseling multi-state compact. The easiest thing to do would be to keep that amount $25. That does line up with the SIPAC privilege to practice fee. We would just need to put in a different line and call it something very similar, but make it clear that it is not a home state privilege to practice. It is really a out-of-state privilege to practice or something similar to that. That way we know that we can contact the professional counseling multi-state compact commission and say, here's how much the privilege fee would be for Kansas. So whenever you do charge this to people who want to practice in Kansas under that compact, here would be the amount that the compact commission would collect and then send to Kansas after they got that from the licensee. So if there's consensus on an amount of $25, we can move forward with that. If there's discussion on a different amount, but I just kind of walked through that. It's a little complex. Each of these compacts are different. But I think since it's not a home state privilege to practice, it's really an out-of-state privilege to practice fee. I think we do need some additional language in the regulation.
So
Questions or
David,
comments? Go ahead.
so David, this is in addition to what an individual from another state would pay SIPAC to get a multi-state license. For
Well,
each state that they want to have the privilege in, they have to pay a separate fee?
So for social work, they have a multi-state license where once that becomes effective, every state will be able to issue either a single state license or a multi-state license. And they can decide the amounts for both of those. For professional counseling, the way their compact works is you still need to have a license in your home state. But if you wish to practice under the compact in other states, you will need to apply for a separate privilege and pay a separate amount depending on what states you want to practice into. So it's a little bit different. The social work one, you pay the one fee in your home state, and then you're authorized to practice in all the states.
Right.
Professional counseling is a separate fee depending on which state you want to practice into.
Okay, that was what confused. I thought that the social work compact was patterned after the SIPAC compact. So I didn't realize there was that difference. Thank you for clarifying.
Yeah, it's a little tricky because each of the compacts is structured very differently. And so there are some similarities, but in terms of the way that they operate, yeah, they're a bit different.
Other comments or questions? Do we have a consensus to move forward with Dave's recommendation?
Yes.
Yes.
Okay. And just to let you know, we don't know if this will open up the doorway and we'll have a lot more people practicing into Kansas under this compact, or if people will let their license expire as an out-of-state licensee and choose to practice under the compact instead. So we will monitor this and check out our out-of-state license numbers. If it seems that we're losing revenue because we're losing a lot of out-of-state licensees who are choosing to practice with the compact instead, we can bring this back to you. But as of right now, we just don't know if it's going to make a lot more people practice in Kansas or just going to be a replacement. So.
Very good, thank you. That moves us to new business on the agenda. Recommendations from the advisory committees. First, Licensed Psychology Advisory Committee.
Okay, so at the last advisory committee meet or the last board meeting in November, we walked through a change to the educational regulation for psychologists. So basically the education regulation as it stands right now requires that individuals need to have attained some of their education while they are quote unquote in residence. And that definition as it is defined means that you are physically present at the academic institution in the physical proximity or face-to-face contact with core faculty members. Basically, there were some recent changes that the advisory committee had recommended. One of those was for online schools. So instead of saying you had to be physically present at the school, the proposed change would be that you would be physically present at a location identified by the school. It's a slightly different way of phrasing that, but it allows online only schools to be able to provide a physical in-person alternative to their campus if they don't have a campus, where you still have that training where it is in the same physical proximity. So it would meet the requirement. It just, the school doesn't have a physical campus. They really can't meet that standard right now. Additionally, there is also a question about the definition of in residence, because for 4 of the other professions, social work, professional counseling, addiction counseling, and marriage and family therapy, they recently changed their definition of in residence to open that up. You may recall that a year ago, the regulation was going through that would say someone could meet certain in residence requirements if they were either physically at the school in front of core faculty or by face-to-face contact by screen. So it allowed the synchronous video conferencing. The problem now is you have the in-residence definition for those professions, you have the in-residence definition for the psychology profession, but they mean different things because the psychology definition still requires a physical presence. So what we wanted to bring to you today, and the advisory committee for psychology did recommend, was basically striking the definition of in-residence from their regulation, but on the courses that would still be required to be physically in person, that specific language from the in-residence definition will just be carried to that part of the regulation. So when you're reading it plainly, you can see that there is a requirement that these courses do need to be taken at a physical location identified by the institution, but you're no longer going to be using the term in residence. So it kind of resolves that inconsistent use of the term. So wanted to bring it to you just as an additional adjustment for that profession and see as a board if you are okay with making this change to the educational regulation.
Any comments? Anything, Richard, you want to add, or Linda?
No, I think that Dave explained this really well. There's just the burgeoning number of schools that are online, and this adjustment, the advisory committee found it to be a reasonable one to accommodate those schools that are online.
So that way, if
There's-
a school is primarily virtual, but they have identified partnerships with campuses around the country for that residency or, in-person portion, that because the way it read before, they had to go to the institution, the actual brick and mortar, in order to be able to have that count. Well, some of these educational universities don't have a brick and mortar anymore, but they do have partnerships with different entities. So that's what it's getting at.
Or
Like they may
they
be-
need hotels or different places.
I was just about to say that. So they may meet at a hotel for the course of a week, and that would be the residence of the institution for that time.
Yeah.
This also addresses a concern by the Joint Committee on Administrative Rules and Regulations, JCAR. They had, in the past, when they've gone before them, they had made a comment about wanting to stress that agencies use consistent terms. And so in going through some of this, working with Leslie, it was an item of concern that we might be using a certain term, and for one profession, it would mean this, for other professions, it would mean something different. So that easily could be confusing to members of the public or licensees. So with this, I think you still get what's currently in the regulation. It just clears up the two different definitions for the terms.
Okay. Do you need formal action on that?
Either consensus or a vote.
Do we feel like we have consensus? Very good. On a thumbs up. All right.
All right. Well, thank you.
And I just want to thank you all for being amenable to this change. It is certainly doctoral training as a psychologist is ever rapidly evolving. And this is one of the things that we are encountering more and more often as we get applications from potential licensees.
Very good. Next, we'll go to Master's Level Psychology Advisory Committee. You want to summarize that?
Sure. And this is a very similar item, but for the other profession that still has the in-residence definition that would require physical presence, that would be master's level psychology. This relates to different coursework, but specific to psychotherapy and also testing. And so basically consistent with what the licensed psychologist advisory committee had recommended, the proposal for the master's level psychology advisory committee would be to remove the definition of in residence from the regulation, but for the specific coursework that would require some level of either in front of certain faculty or being physically present at an institution, that would be basically right with those courses where that would be required in the regulation. So previously or currently right now, the regulation does say for psychotherapy, those courses that are required would need to be in residence, and for testing, it would need to be in residence as well. The advisory committee discussed both of those different topic areas and decided that the new definition of in residence would be appropriate for the psychotherapy. So basically the language of the new definition, as it would allow for either at the physical location identified by the school or face-to-face by screen, by synchronous video conferencing, would be fine for the psychotherapy coursework. And for the testing, that would be the language the psychologists are using for their language that deals with still being in the physical proximity in front of core faculty with that. But they're not core faculty for master's level addiction or psychology, but you would still be at a physical location identified by the school for those testing courses. It's just that language would appear in a regulation next to that versus using the term in residence in the regulation.
I'll just add to that. I think the advisory committee is going to talk some more about the testing coursework and try to find if there are programs out there that are able to do that without requiring students to be either on campus or in a physical location with staff. So that may we may have some recommendations for that in the future. Any questions, comments about that? People comfortable with moving forward with that change?
Yes.
Okay, very good. That takes us then to educational standards to take the EPPP.
Okay, so for this recommendation from the Master's Level Psychology Advisory Committee, basically you have a licensing test that is shared between the Master's Level Psychology profession and also the PhD or licensed psychology profession. It's called the EPPP. And in our statutes and regulations, it says if you would like to become licensed as a PhD level psychologist, you meet the educational requirements. And then for the test specifically, you need to basically score a 500. For master's level psychology, you need a score of 400. And so if you take the test and you score above a 400, but less than a 500, you will be able to get your master's level psychology license. And if you would like to become an independent practitioner, get your clinical license, it's called a licensed clinical psychotherapist. You need to get 3,000 hours of postgraduate experience. And then when you have attained all of your hours, you need to pass the EPPP at the 500 level. If you pass it the first time and it's above 500, you never need to retake it. But those are the two different requirements. If you want to practice as a master's level psychologist, you have to get at least a 400. If you want to practice as a licensed clinical psychotherapist, you need to get a 500. So what people have brought to the advisory committee is that there may be some individuals who took the test and scored just below a 500. And so they're qualified to become a master's level psychologist. They are accruing their hours towards becoming a licensed clinical psychotherapist, but they are having to wait 2 years before they can take the EPPP again. And they have argued that having to wait 2 years, their score is not going to be as good as it would be if they could take the test right after. The issue is that historically we, as a licensing body, we control who's able to take the test. And part of that is because for the psychometric results from the test, they need to know that people who are taking the test are actually qualified for the state licensing boards. So they don't want anyone to just take the test to skew the results, pass rates, and things like that. But since it is the same test, it does not seem that, like for the other professions, they have a separate, for most of the professions, they have a clinical examination that is based on skills that you would be learning while you're out there practicing. And so when you take that clinical test, you have learned more to be able to do pass that test. For this profession, it's the same test. And so they had asked if there was the ability for people to take the test without waiting the 2 years. And so the advisory committee was supportive of it. We reached out to ASPPB, which is the association that oversees the test. They basically said as long as the foundational coursework for the license has been completed, they don't have any issue with that. They did say there is a limit to only being able to take the test 4 times in a calendar year. But that is the only real limitation. So for us to be able to effectively control and still have oversight of the people who are taking the test, we came up with a proposal the advisory committee did recommend that would say, well, actually, we also looked at the statutes and regulations to see what we would need to change to make this effective. And really what the regulation says is that the person had met the educational criteria as approved by the board. So really,
And has an active application.
Yeah.
That's what we would need to change.
okay. And so, so for us to make this work, we thought we might hold it out for 2 different groups of people to be able to take the EPPP again. One would be for individuals who have an active application for licensed clinical practitioner. Those people are already able to take the EPPP. Or if you currently hold a LMLP license. So that means that you have met the educational criteria for that. So as long as those 2 things either of those would be met, then we would approve the person to be able to take the EPPP if they wanted to continue to take it to try to get the 500 score. So.
And they could take it up to 4 times in a year.
That's right. And that's a limitation by ASPPB, so we can't control that. but we could make this change and allow people to take it again. So this was a proposal for the master's level psychology, and I'll go ahead and pause there and see if the board is supportive of us making that change so people can take the test again in that situation.
Does anybody have a question?
So this would allow someone who was already licensed as an LMLP and practicing with or without accruing hours towards their clinical psychologist to be able to take the test that they need to pass in order to become a clinical psychologist. Am I hearing that right?
That,
Clinical psychotherapist, yes.
right. That's the
Oh,
that's the-
psychotherapist. Okay. So, but that's even if they haven't made a plan to become a licensed clinical psychotherapist, right? They might be an LMLP practicing under supervision. They could go ahead and take the test that they need to have passed at the 500 level before they start any plan to get their psychotherapist license.
I believe as it was recommended, yes, that's true.
People also who are going through their doctoral program get an LMLP for their internship, for their doctoral level internship. So this would also allow them to test again if they don't pass at 500.
To be able to get that LMLP. Okay. I'm just thinking that, you know, I don't think any of the other professions can take that level license or that level test before they apply, before they have a plan to get their clinical license. But it's not a separate test. This isn't another level of test. It's the same one that you need for LMLP. Okay.
It's the same test.
And there wouldn't be any advantage to being an LMLP and retaking it if you're not planning to get your LCP, right?
Correct.
Okay.
Any other questions or comments? Everybody okay with us moving forward with that?
Mm-hmm.
All right.
Okay, so there was another item that I wanted to kind of bring to you. It is not an official recommendation by an advisory committee, but I think for consistency, it would fit along with this item. So for most of the professions, there is a separate clinical level examination, and the board requires passage of that to get a clinical level license. One exception is the marriage and family therapy profession. So for that, individuals getting their license, marriage and family therapist license, have to get a score at a certain level. And then to get the clinical license, they have to pass the test at a higher level. So it kind of works the same way as EPPP. If they wanted to get the clinical license, if they took the test once and they reached that level, they never have to take it again. But if they reach a lower score in Kansas, we're unique. We're one of 2 states that has a permanent level license below, you know, what a lot of states would require. So it's kind of the same situation. It's the exact same test with 2 different pass points. And we have approval to license people for that permanent license. But we thought we would bring this to you to see for consistency, it's the exact same test. If people in that situation for marriage and family therapy would be able to take the test without having to wait till they got the 3,000 hours in that situation too.
Any comments? Seems like the same circumstance.
Okay.
Is there consensus to support that?
Yeah.
Head nods, thumbs up, very good. Thank you. All right, that takes us to a possible bylaw request from ASPPB.
Yes, so we talked about the proposed bylaw amendment from Texas as we were preparing for the ASPPB annual meeting, and how the board of ASPPB had made a decision that all states would need to require passage of both EPPP and EPPP2 as of January 1st, 2026, and that some states basically had a real struggle with implementing that, and there were other issues about requiring the passage of EPPP2. And so Texas and a number of other states worked together, and I think there's no other way to look at it. I think the actions of those states working together really helped convince the board of ASPPB to change their mind and really come together with this task force to work on this item. I don't think the work is done at the national level. I think, just to be direct with you, I think this association needs some fixing, and it needs to be fixed by member states like us. Their association bylaws have not been updated in 11 years. And I think that means that they're probably stale and they need to be adjusted. And when this item was being put forward by representatives from Texas and other states, there were people from other states that were saying, this is crazy, it's never been done before. They were even using terms like this is mutiny. And in my opinion, that's ridiculous. You know, what they tell us at the national level is these associations are that all the states and all the provinces and the territories that we make up these national associations, and we send delegates and we volunteer on these committees. And yes, there is a separate group of staff members, but really, you know, we elect the board, we define what the association can be and can do. And so what I'd like to do is I want to get your support for this, but I didn't want to do it without coming to you and talking to you about it. I would like to work with some other states to basically put a letter forward to the board of ASPPB, asking them to create a bylaw committee to make recommendations on proposed changes. And I think some of those have to do with states being able to bring an item to the body in a much cleaner fashion, the ability for states to be heard in terms of some of these issues, and more transparency for the board. As you may recall, you know, the board's decision to do this was not based on the vote of the body. It was something the board did for ASPB board. And then when the body was going to bring forward the bylaw amendment, the board met again and issued a letter 1 week before the annual meeting. And so I think people are saying, you know, we don't know when the board of ASPPB is meeting. We want to hear the discussions. We want to hear what the board is considering. And so I think there needs to be more transparency for this ASPPB board. And I know there's other states that feel the same way, but I would like to work with them to draft a letter to request this bylaw committee. And then if the committee is formed by the ASPPB board, I'd like to go ahead and serve on that committee to make sure that we really put forward some positive changes. But like I said, I didn't want to move forward on this without kind of talking to you all about it. And I wanted to make sure that the board here in Kansas was supportive of doing this. But I think, you know, people are listening to our position as a state. I think we are respected on a national level. So I think we can make some real positive changes. And I think this is going to help a lot of other states when they have similar issues in the future. So just want to pause and open up for questions, see if you have any comments or concerns. I don't think that this committee will take a lot of time away from my role here, but let me know if you have any feedback or questions or concerns.
I just have to throw my hat in the ring with support for that, because as somebody that was there and saw that whole process in play, I agree with David that there are transparency concerns about it for an agency that holds the sole contract or sole testing process for people that are going to become licensed psychologists, and then to arbitrarily change some of the requirements without consulting with the member agencies, I think was, as David said, there were words thrown around like unethical and some other more strong words. But I can't think of anybody that I would like to represent us as psychologists better than David on that committee. So
if I might add, it's not really an addition. It's to reiterate the point that Linda just made, as well as what David said a little bit earlier, and that is that this was foisted upon psychologists. This was a unilateral move from the board to institute changes in terms of the each will be two. And people were not very happy about it. Just like the Licensed Psychology Advisory Committee, there were members that were not very happy about it when we had the executive director of ASPPB present to us. Their voices were they rang loud and clear about this matter. People were not happy. They still remain unhappy because of the prospect of when the board could meet to make the change to re-implement what they had originally foisted upon psychologists and the states. So that's just me reiterating what has already been said. I'm in favor of this.
I would add just one additional 2 cents is that I've been volunteering on one of the ASPB boards. I guess it's the e-passport appeal committee. And it's been one of the more challenging things I've ever done because I think I would trace back to that transparency issue. I mean, they claim that it's an appeal, but the actual guidance to those of us who are on this appeal group is that the only reason an appeal would be granted is if there was a mistake made, as opposed to any kind of actual policy-based judgment, which to me, if someone thinks they're appealing something, they're seeking that. And so, that goes to this transparency issue. I mean, I think they need to clarify, for example, that an appeal is not a way around the guidelines that have been established. It's more of a reconsideration, I guess. And so I think that falls into the same category where it seems like there are some governance issues that it'd be worth raising.
I too would support this. I think without the intervention of the group from Texas and the support from Dave and other states, then as Richard indicated, we'd be dealing with something that we had no say-so in, and that would dramatically impact people trying to be licensed in the state. So I think it's a really good idea. And I support Dave's desire to kind of participate in the process of making sure that that doesn't happen again, because they've just paused this, right? And so I think it behooves us to have more of an active role in what's happening there. Everybody comfortable with Dave participating?
Yeah.
All right. Very good.
Thank you.
That moves us to possible change to hold applications open for 24 months as opposed to 12.
Yeah, and this was something that I talked to Leslie about and wanted to bring to you just for your consideration. Currently, right now, when someone applies for licensure, their application is held open for 12 months. And if they don't provide the necessary documentation within the 12 months, basically their application expires. And then if they wish to be considered in the future, they need to reapply and pay another application fee. Depending on how many materials they provided the first time around, they may need to provide some of the same materials, maybe not all, but that's sort of how it works. And so, and somebody has a temporary license that lasts for 2 years. And so, we wanted to kind of just bring to the board, if your preference is for us to continue to hold applications open for 12 months, or if it would be better if we had applications that lasted for, let's say, 2 years or 24 months. That would give the people who are applying for licensure who didn't have a temporary license more time to take the licensing examination or provide materials. On the other hand, it would probably increase the time frame before we could close out those applicants who are not providing documentation or not following through with the process. So let's say, did you have any comments as far as that goes?
No, when you were saying that, though, maybe it could be written where they have to have a complete application within a year. Complete applications will be held open for 2 or something like that, because it's really not what the reason that we talked about it is not for people to continue to be able to send us stuff because sometimes they just ignore. But the people who are having trouble passing the exam, so they're not working in the field, so that and then they have to reapply and get new references, and and it just seemed more fair.
We've also had some instances where the temporary licenses are designed for people to be able to practice while they're taking the examination. But since that time frame for the temporary license is 2 years versus a 1-year application, I think we've seen some instances where someone applied for a temporary license purely to hold open their window longer, even though they weren't practicing. But you can only get those once. And so
Right.
if you waste that opportunity, you're never able to practice under a temporary license if you're using it just to hold the window open longer.
Is there any other circumstance other than not passing the test where people do this?
Where they do what? I'm sorry.
Or they hold open?
I actually just saw it in another state. That's what made me think of it, because they said, what theirs said is if they took the exam within a year, then it would continue. For 2 years, the application would be held open. We tried to do that with temps and it was difficult to enforce that. But I don't, it may be more feasible with our new licensing database. I don't know, so. No, really, I think it's just for the people who have trouble passing.
Sure. Questions, comments?
Is there a
So
way
are,
go ahead.
so Leslie, are you saying that if they have everything in, but by 12 months, they could get another year to give them a chance to pass the test?
Right, or I mean, you could shorten the time and say, an application must be complete in 6 months or it expires, or a year and it expires, but a complete application will be held open for 2 years.
Yeah, I think I would want that provision that it has to be complete within a year, because otherwise you're just holding on to paperwork for 2 years.
Right.
People aren't following through. And
Right.
If people can't get their everything that they need in within a year, that might speak to how they're going to manage being licensed and the requirements of being a licensed professional anyway.
Right.
Jim?
I could be comfortable with, as long as the application is complete within 12 months, to extend the, if you would, hold application process open while people try or reattempt to pass their examinations.
Other comments? Are people comfortable with that?
Yes.
Okay.
Okay.
All right.
I have to jump off, you guys. I have a meeting at 1.
Okay. Thank
Sorry.
you.
Thank you.
As do I, thank you.
Me
Sorry.
too.
We're going to talk about discussion on speaker authorization for legislative testimony.
Okay, and we do still have 1, 2, 3, 4.
We'll be down to 6.
We are now down to 6. So I will just bring this up for discussion, just to let you know kind of what we talked about in the past. So every legislative session, we have normal times where I will come before the legislature and I'll present information. Basically the board has delegated to me to speak on behalf of the agency when it comes to things like the budget hearing, and if there's bills relevant to the agency. And so in this situation this year, there may be other bills relevant to the BSRB. So every spring, I do try to bring it back to the board for it to continue on or do something different in terms of who's authorized to speak for the agency. We now have dropped below quorum, so we can still have discussions, but it
looks like we have 7, right?
Jim, Richard, Andrea, Cynthia would be 4, and then here in the room we have Denise.
I counted myself twice. Counted myself on the screen.
We did drop one below quorum, unfortunately. But yeah, so I think we'll probably just need to proceed with what we've done in the past in terms of board members can provide testimony. You can submit things on bills. Just make sure that you're not saying you're speaking on behalf of the board, but you can identify yourself as a board member if you choose to do so, or as a chair of the advisory committee for the board. Just make sure you're not speaking on behalf of the board when it comes to submitting testimony like that.
Very good.
And then if there is opportunities, if we have a number of bills that pop up and there's opportunity for us to schedule a really quick meeting to get board input on possibly introducing testimony, I'll go ahead and reach out to you, see if we can schedule something really quickly, like a little half an hour meeting. Sometimes we don't get that opportunity, so I'll do my best to go ahead and just, preserve what we've talked about in board meetings, make sure that I communicating the positions previously taken by the board. And if there's opportunity for us to weigh in specifically on a bill in the future, I'll try to gather the board to provide input on this.
Given we don't have enough for a quorum, I assume that means we cannot go into executive session?
No.
Yeah, okay. I'll just indicate that I had sent you all a copy of the results of the performance evaluation for Dave in his position as executive director for BSRB. And so that information I sent you was a summary of all the results I got back, both the scores and comments that were made. I had planned to talk with Dave about that today, but I was going to wait to make sure that the board was comfortable with my proceeding, or if not, we would go into executive session. So I guess we'll have to wait till next time. That'll be our plan. Speaking of which, that's scheduled for March 10th.
Can it wait that long? I don't know the timeline.
Yeah, so basically it just the expectations of the board members document talks about the board will provide an annual performance review for the executive director. So it doesn't really give a lot of more specificity than that. Now we could, schedule another meeting just kind of for that purpose. But I will send something around maybe as we get started with the legislative session to see if maybe we can have a meeting a little bit earlier in the March meeting. But as of right now, unfortunately, because we dropped below quorum, we can't take any official action.
I am comfortable. I don't believe the regulation says the board needs to approve that presentation of the review, if you would. So I'm fine. I think the board has seen it. The board got everything back. And I believe if you haven't gotten anybody pushing back on it, I think it's fine to review it with David at this point.
Okay. I'm comfortable with that too. I tried to get it out enough in advance so that people had an opportunity. I didn't have anybody respond with any questions about what I submitted. So everybody else.
I agree with Jen.
With that as well. I would hate to prolong it until March. Or if, David, if you wanted to, it's up to you, but if you wanted to send an email out and tell people they have to reply if there's any concerns, and then, but I'm also comfortable since you're there and can have the conversation today.
Yeah, I think we'll plan to do that.
Okay, I move to adjourn.
All right. Very good. We have a motion and we have a second. All in favor, please say aye.
Aye.
Thank you all. Be safe out there.
Stay warm.
Thank you.
Lots to discuss. Yes.
Yeah, I should have kept a